Hi, my name is Madison Bracken. I am a PhD student at UMass Amherst, and today I'll be sharing my research on how college students may have benefited from their social media use during the COVID-19 pandemic. Previous research has shown that in-person social support can buffer against the negative effects that stress has on mental and physical health. But when support comes from less traditional avenues like social media, the findings are really mixed, and this may be due to looking at these relationships under day-to-day circumstances rather than during an acutely stressful life event. This research study aimed to test whether the stressful context surrounding the COVID-19 pandemic provided the right circumstances for us to observe a stress buffering effect from online social support. Capitalizing on a study already in progress, data collection occurred 3 weeks before and 4 weeks after universities transitioned to remote learning. Participants were undergraduate psychology students who earned course credit in return for completing an online survey and were eligible if they reported using at least one of these 3 social media platforms. Participants self-reported their perceived social support from their offline and online networks, stress, and depressive symptoms. Similar to what past research has found, offline social support evidenced a stress buffering effect on depressive symptoms, but these effects did not depend on the COVID context. Compared to the pre-COVID study participants, students who were assessed after school closures had significantly higher levels of stress. The results of this research study supported that when participants had high levels of online social support, the relationship between stress and depressive symptoms actually was weaker, and this was only true in the early weeks of the COVID-19 pandemic, while controlling for offline social support. The study highlights the important and positive role that social media may have played during this uniquely challenging time, and this research has both theoretical and applied implications, as it may suggest a potential avenue through which people might cope with stress when access to offline support systems is limited.